Hi, I'm Dr. Eric Schnipper from Lenox Hill Radiology in New York, and I'd like to talk to you about the importance of continuity of care and why it's an important thing to have every year your old images seen by the radiologist who's looking at this year's mammogram. Now, every year when we do a mammogram, it's essentially a snapshot in time. It's what your breast looks like in one moment that year. And like anything else, if you were looking at family photographs, for example, it's important to be able to see the change from year to year to year. And the reason why that is it's very difficult sometimes to detect a breast cancer, particularly when it's hidden underneath dense breast tissue. And subtle changes from one year to the next can make a big difference in terms of our ability to detect breast cancer. So if you've had a breast mammogram performed in a previous year at another facility, we encourage you to get those images onto a CD from your old practice and bring them in to us. And that way the radiologist will have the most information available to him or her to evaluate your breast and detect breast cancer, because it's those subtle changes that can be very important. And one great thing about RadNet and any of our affiliates is that when you come to RadNet, we can store your images, and every image you have from this year on will be available to the radiologist looking at it in subsequent years. So in other words, let's say you go to one of our offices near where you live, and next year you'd rather go to one of our offices that's near where you work. Well, because our system is so broad and we have so many different locations, we can continue that continuity of care by having those images looked at from last year and the year before and the year before that, and compared to this year's images. And what that means is that it's that much more likely at a large practice like RadNet that we're going to be able to detect breast cancer as it sneaks up on us that year in the future. So when you do that, and when you have those images, those prior examinations, and we can have that continuity, it makes for the best possible exam and the highest diagnostic accuracy. Thank you very much.